Healthcare providers from the Ministry of Health, Wellness and Elderly Affairs have been actively engaged in specialized diabetic retinopathy training as part of the ongoing Vision 2020 Links and Networks initiative, which was launched in 2018. This initiative underscores the ministry's unwavering commitment to preserving vision and enhancing the quality of life for individuals at risk of diabetic retinopathy. As a common complication of diabetes, diabetic retinopathy poses a significant threat to sight, often leading to irreversible blindness if not promptly diagnosed and treated. The training equips healthcare professionals with the skills and knowledge necessary to address this pressing public health concern effectively. As she shared more details of the various components of the diabetic retinopathy training, Dr. Kova Bhaskaran, the diabetic retinopathy technical lead, highlights the growing global challenge of diabetic retinopathy, emphasizing its alarming status as one of the top 5 causes of blindness worldwide, with prevalence rates continuing to rise despite ongoing efforts to combat preventable blindness.
It's now 7 years since the program started, and with COVID in between, which means about 6 years of active program. And one is the review of everything that has happened, from not having any diabetic screening to what they have achieved, which is great. And the other is a refresher training on grading the retina to diagnose people that need some treatment to avoid blindness. And that's done through a team from Frimley Park Hospital in the UK, who are the official link with the Saint Lucia team. So we have 2 medical retina specialists who are training the graders on recognizing retinas, and for some of them it's a refresher, some of them are just newly trained, so it's more a new training. Yeah.
Health officials noted that this program not only reinforces Saint Lucia's capacity to combat diabetic retinopathy, but also aligns with broader public health objectives aimed at addressing the growing prevalence of diabetes. Optometrist in the Ministry of Health, Louise Solomon Purcell, speaks with us.
We've had an awesome 2 days of training here. We've had some doctors from the UK to come and train and retrain us on the importance of detecting diabetic retinopathy. As you know, diabetes is a big problem for us here in St. Lucia, and diabetic retinopathy affects a lot of younger working age population. And what we're trying to do here is trying to stop people losing their eyesight and going blind at young ages. We want to be able to help people and intervene as early as possible.
Registered nurse Amber Antoine explains how the training transitioned from theoretical discussions on diabetic retinopathy to hands-on practical sessions.
So we're here today doing the practical aspect of it. We're basically screening our diabetic patients for those complications that we learned about yesterday.
The Diabetic Retinopathy Training Program represents a pivotal step in ensuring the country has the skilled personnel and resources needed to deliver quality eye care services. From the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Onika McCoy.